Good morning. This is Steve Stites. How are you? Chief Medical Officer here at the University of Kansas Health System. I'm joined this morning by my good friend and also the president of the Kansas City campus of the University of Kansas Health System and COO for our entire system, Tammy Peterman, and the medical director of infection control, Dana Hawkinson. We're back live here at the studio at KU. We hope that everybody had a healthy and happy and socially distanced weekend. Yes. I saw someplace today that it's supposed to be physical distancing because we're not really distancing socially because of all the different apps and things you can do, et cetera. So physical distancing, but I think the term social distancing is have sort of taken hold. So hope everybody's healthy on this end of March, and I'm going to turn first to Tammy Peterman. I think she had a couple of opening remarks she wanted to give.
Sure. I think first of all, I want to say Happy Doctor's Day.
Thank you.
Because today is Doctor's Day, not just here at our place, but across the country. And what I know is that this is a little bit of a different Doctor's Day for all of you and for all of us. And we also know that we have amazing teams, and whether it's at our place or any other place across the country, I think that doctors and nurses and respiratory therapists and the rest of the team work well together every single day. And I think we're seeing that not just at our place, but certainly at places across the country. So happy Doctor's Day to my friends and colleagues.
And can I just say the happiest doctor is the one with the best team.
I think that's exactly
all
right.
The difference.
I totally would agree with that. I know that nurses would agree with that also.
Yeah.
Here's what I know is that we have a really generous and giving community. I am grateful every day for the community that we live in. And what I've seen over the last few weeks is this amazing outpouring of support, whether it's been donations or a video or sending something to our staff or words of encouragement. It's been pretty remarkable. And we are appreciative of every one of those gifts. I'll talk a little bit more about some of those gifts, but I just think one of the things that we have to remember living in Kansas City is that we have a great city. People love our city. We love the people in our city, and we want to make sure we are protecting this city. And I think people are doing a great job of that.
It is true.
Yeah.
Dana, how was your weekend?
It was
good.
good.
Stay socially distanced?
I did. It was good to be outside. I did see a lot of people who were doing some social distancing and maybe not so much physical distancing. During this time, again, to keep everybody sane and healthy, I think it's important for physical activity and getting outside and getting in the outdoors and a little bit of sun, although our dermatology colleagues would not agree with that, is probably good and a little bit healthy. However, I did notice that even at the parks, there were a lot of people who were not necessarily physically distancing. And I think that's what we need to reinforce is that if it's not a person in your household, then you probably should continue to be physically distanced from those people. 6 feet or more. I did see a couple groups of 7 or 8 younger people, teenagers and people in their 20s and 30s meeting at the park, meeting for a lunch, bringing pizzas, and that's the exact opposite of what we want. So if you can be out there physically distanced, but not meeting in groups when you're outside, that is what we are trying to go for. We don't want the contact between members of different households, because then if one person in that household has the infection, it can easily spread to other people in that kind of way. So definitely get outside, be active, but be smart about it and continue the physical distancing.
All right, folks, we're open to your questions. What kind of things are you thinking about today?
This is Angie Rose on TV5. I was going to ask you about masks. The CDC has said don't wear a mask unless you're sick. But then the New York Times had an article over the weekend saying, well, maybe some protection is better than no protection. And when I was out buying groceries, I noticed a ton of people either wearing masks or wearing bandanas. So 2 questions related to that. One, do you agree maybe some protection better than nothing? And then also, what would this do to supplies in this area if people started wearing masks?
Okay. Dana?
Well, the first thing for bandanas, I don't know the utility of wearing bandanas. But that's another very good topic that you brought up, because also over the weekend when I was outside or in stores or at the parks, I saw a lot of people wearing masks. Again, as Dr. Stites alluded to, last week. It's not just floating in the air. It's not just walking on the ground. The virus we're talking about. But the masks certainly, when you are wearing them, they do offer a little bit of protection. However, when I'm seeing people, they are moving their mask up and down. They're fidgeting with it on their face. At that point, you're contaminating everything. In addition, you're also bringing your hands to your face. And if the most likely method that you're probably going to be infected is if it's on your hands after you've had high-touch surfaces and you're getting it into your eyes, your nose, your mouth. So I think in this case, the masks are actually offering a false sense of security and actually maybe even contaminating your face even more as you're manipulating the mask.
So you touch the mask with your hands, the mask already has some stuff on it, and then you take your mask off, and if you're not careful, you just rub everything on your face. So,
exactly.
it's really, the way we do mask is actually pretty thoughtful of how we instruct folks here to do that. And supplies do make a difference. And so it's one thing if you want to make your own homemade mask or bandana or whatever, trying to leave the surgical masks in the hands of medical folks and healthcare folks because we need those to help take care of patients. So
I do want to mention that we've had a number of donations of masks. We had, you all know that there was a donation drive just this last weekend, I think at one of the Blue Valley Hilltop locations, and the donations then went to Children's Mercy and to University of Kansas Health System, and we're so appreciative of those. I will tell you that the community has really rallied, and they are looking and finding more masks than we ever would have imagined, and whether we're getting those from Lowe's or we're getting those from construction companies or individuals, those are really so appreciated and valued, and we have an entire team who are really working on making sure that we're utilizing the appropriate mask, and we're taking in those donations. We have one FTE, one individual, who's donated just to managing all the donations that are coming in right now.
That's great.
other questions?
Hey, this is Alex Smith. This is Taylor, Channel 41, and kind of in that same regard about TV and that kind of thing. I'm curious about hand sanitizer and how easy it is for hospitals to get that. Are you guys struggling to get the proper amount of hand sanitizer that you need on a hospital level? Because I'm also interested, we've done some stories on J. Rieger creating their own, and they've told us they're supplying that to the hospitals. Are you guys using any of the J. Rieger hand sanitizer, and how hard is it just to get it in the hospital right now?
We're tracking every one of our supplies every day, actually all day long, and the leaders are getting a report twice a day, so we know exactly how many we have. I haven't seen the morning report, but yes, we are appreciative of Rieger, and we are utilizing some of that hand sanitizer. We also had donations just last week from Lockton, some hand sanitizer, so we are appreciative of those, and we're also tracking that because we know that across the country that's been a bit of an issue, but I think we're in, at least today, we have what we need from a hand sanitizer perspective.
And you can use it, you can make your own with alcohol and a little aloe vera or whatever you wanted to add to that to soften it up a bit. But I think the price of alcohol, I was told by our supply chain, has tripled online to get it, and there's beginning to be a shortage even of isopropyl alcohol. So right now we're good, but give us a few more weeks, we'll see.
Hi, this is Alex Smith with KCUR radio station. 2 questions. One, have any medical staff at KU been tested positive for coronavirus? And 2, what is KU doing to increase medical staff or, possible backup people, in the event of a surge or medical staff being out because they're sick?
You bet. Well, we do have some medical folks and healthcare professionals here who have tested positive, but no faster than the rate of the general community. We think, in fact, it is community spread because when we trace those people, they really had not been in contact with a patient who had COVID-19. So we believe that most of the folks, if not, in fact, all of them, have really been community transmission, which is pretty common. Right? I mean, if you're going to have a community transmission, there's nothing that's going to protect you as a healthcare worker versus another citizen in the community. And when you look at most of the rates for healthcare professionals around the world, that's really been the story. When we spoke with the folks from Wuhan last week, you guys, remember we referenced that last week. We spoke to healthcare professionals from the largest academic university in Wuhan, and they had the same story, that they didn't have the right PPE in place. And once they did, they didn't have patient to healthcare professional spread. Still, the fear is that if 30% of people end up getting this virus, the coronavirus, SARS-CoV-2, then what could happen is that 30% of healthcare professionals could get it. If 30% of healthcare professionals get it, it puts a drain on the workforce. We have plans that we've made to try and bolster that. We're not at the point where New York is right now. I think they've offered people to come out of retirement. They've tried to bring people from other parts of the country in. If it does come to that, we can implement those plans. But right now, we believe our workforce is strong enough, especially with all the learners we have, to be able to withstand that. As we keep saying, it all depends on the slope of the curve, which comes back to what can you affect to make that slope different. And really, there is only one thing that our community can do, and that is to follow the basic rules of this infection control. And that's why social distancing is so incredibly important, along with washing your hands, don't touch your face, and cough into your elbow.
Hi, this is Heather Hollingsworth from the Associated Press. I was just wondering, can you tell me hospitalizations today? I know you gave stats last week on how many people are on ventilators and how many people are in ICU. What does that look like today?
I don't know that we haven't. Would you ask us that at the end of the broadcast? We haven't gotten today's numbers yet, and so we texted, "Hey, can you send us the numbers?" But we can give you last night's numbers. But let's see if before the end of this broadcast we have today's numbers. Is that all right?
I mean, could you? That would be great. Can you talk to me about whether it looks like it's going up this weekend, or just generally?
It did go up this weekend. It went from like 18 to 22 to 23, and so it has gone up, not at a super fast rate, but it did go up a little bit. And I just don't. So here's the real thing. If you think about it, Kansas City took, and the Core 4 took their social isolation policy and really put it into effect on shelter at home last Monday, or Monday, Tuesday at midnight or whatever. And so you think that really will take 7 to 10 days for that to take effect. Because we measure people who are sick and need to be hospitalized, and it usually takes about 7 days for those folks to get the virus, become ill, and then have to be hospitalized. Now, if we were having a lot of community testing, which we don't have in the United States, and we might have a little better measure of how much it's working, but it'll take 7 to 10 days to see if the shelter at home has really had an impact. And what we are doing is trying to measure very closely the numbers of patients that we have, and that's kind of our placeholder for how well that's working. It's just there's a delay between when shelter at home went in place and then when the people are sick enough to come in the hospital. So we'll tell you more as soon as we get the data. If we don't have it, we'll give you last night's data.
Can you talk about the number of ventilators in the area and how we're doing on that? Because I think that's a concern for a lot of people.
Sure, and we have a team who's working to make sure that we are keeping track of that. We're making sure we know how many we're utilizing every day. I think we have around 250, which seems like a lot, and yet what we don't know is what we're going to need. So we have a team looking at that because we know we can turn anesthesia machines into ventilators, and we also know that we'll have access likely to a stockpile, and we're not including those in our numbers as either. So, Steve, I know that we've got a critical care team who's working on that right now.
We do, and the Kansas City's a little funny because people don't have to reveal their numbers, and especially the Missouri Hospital Association has a policy, and it's kind of to protect hospitals from data and from having to say specific data. It would be great to know some of that specific data, and that way we would have a better ability to plan it. What I do know is that a lot of the healthcare professionals in every hospital are talking. We talk twice a week with the other chief medical officers. I know there's a critical care planning task force here that some of our folks have helped head up, and it's looking across the metro to see how many ventilators we have and how many patients are in ICU beds. What we know is this: if we can keep that R0, remember the R0 is how many patients one person will, and how many other people one person will infect. If we can keep that down to around 2 or 2.2, we're going to have enough ventilators. If that number's at 4, we're not going to have enough ventilators, and we're going to be in a crisis like New York. What can we do to keep R0 as low as possible? and you all know my answer by now, because it's always the same thing. You got to stay at home. You got to try and create that 6 foot of distance. You got to wash your hands. You got to not touch your face. You got to cough into your elbow. Those are the things that we have that have the ability to help us control the virus. It is the most important public health measure available to us. Someday when there's a vaccine, that'll become the most important public health measure. But today, what we have are the basics.
Question for you: when you guys say 250, is that just you guys when you're saying 250? Your
Yes.
hospital has 250 ventilators,
Yeah, and that includes our anesthesia machines. You know, anesthesia machines.
and that includes that. Okay.
Yeah, that can be, we may get up to 278 if we use a few of the older machines. So we have the ability to expand up pretty significantly. Right now, about half of those are in use on patients. So then we have to think, okay, what's our delta? One of the reasons for not having elective surgeries, and we've been at that now 2 weeks ago, it started here, and canceling clinics, and that happened 2 weeks ago, was to try and lower the number of inpatients. By lowering the number of inpatients, you create less demand for ventilators. We've been really successful in lowering our number of inpatients, mostly because of the lack of elective surgery. But that frees up equipment for us to use in the event of a surge, and I think we'll be in good shape. But it all depends on what that R0 value is. The other thing to say is that is our numbers. We don't know all the community numbers.
You need to clarify too, when you said about half of them, they're not all COVID patients.
Oh, right. No. Thank you. That half are just patients who are here because they're sick. Remember that we still have inpatients.
Yeah.
We can't close a hospital for COVID-19. So we do have patients who are sick and in beds for other problems and other issues besides COVID.
If the hospital does need to use all of those ventilators and then, possibly use the other machines, is there adequately trained staff and the numbers of staff to be able to use all of those for all the potential patients?
There are for us, but part of that is because we have large training programs, and we have a large CRNA contingent, as well as a large critical care group between pulmonary critical care and anesthesia, and cardiology and others. So we're our trauma guys. So we're in pretty good shape for critical care at the level we can deal with it. When you start throwing, again, if the R0 value is 4 and we have a whole lot more patients, then that's going to be a bigger stretch. But we'll do what New York's done, right? We just rise up and try and figure out how best to do it. We've had plastic surgeons volunteering to be interns in the ICU to try and extend the critical care doctor. They all did training at one point, and so I think there are all sorts of ways. And we have worked with our residency programs and our medical staff to develop ways that we can rise up to meet that crisis if indeed it comes, because the R0 goes too high.
Are you looking at T-tubing, the machines that we've seen online, where you can take a ventilator and make it support 2 people, possibly even 4?
I gotta tell you, that's a really bad idea, and let me tell you why. So yesterday, the Society of Critical Care Medicine, in conjunction with the American College of Chest Physicians, the Anesthesia Critical Care Societies, and others, put out a statement saying that you are really better at triaging patients to try and figure out who can benefit most than try to do 2 or 3 patients. Someday, if you want to come in, we'll sit down and look at a ventilator, and we can show you why that's a bad idea. But there really is no truly good way of putting 2 or 3 patients on one ventilator circuit. And that's because everybody's lungs are a little different, and the basic underlying assumption of synchronous ventilation like that is that the lungs that you are ventilating, if there's 4 lungs or 6 lungs or 8 lungs, are all acting as one lung. And as a critical care doctor myself, I will tell you that is not how a lung works. It's hard enough to do 2 lungs in one patient. Trying to do 8 lungs with one machine, I think that is dangerous, can actually cost more lives than it saves. And that's what the different critical care societies have said here and elsewhere across the world. Is it theoretically possible? Yes. Is it clinically relevant? Probably not.
So would KU not choose to do that?
I don't think we would do that because it is dangerous. If I put 2 or 3 patients on there, there's a good likelihood I will hurt those patients more than I will help them.
This is Taylor at 41 again. We're starting to see, especially on social media, a lot of stories of patients and people saying, if you don't believe this is bad, ... and they'll tell the story of some loved one or someone in the hospital suffering. Can you give us any instance of the severity of some of the symptoms you're seeing and how they might, I hate to say serve as a deterrent to people, but if people are still not listening, is that an effective way of telling people just how bad these symptoms can be for the people that do contract the virus?
You bet. I don't know if we want to scare people to death, but I think we want to get them scared to life. So, Dana, do you want to try it? I know you're up on the floors a lot rounding up COVID-19 patients.
Yeah, as of last week, I'd probably seen more COVID patients than anyone in the hospital. I think that's changed now as you have your critical care colleagues who've been really caring for most of them. And as a lead into that, I would like to say we understand the probability for someone who's older to have more severe disease, and the decreased probability for someone who's younger, say under 50, to not have such severe disease. But we should know that this disease process does affect people of all ages. Just because the numbers aren't overwhelming, it does happen, and that could be anybody. We have seen now reports of babies or neonates. We've seen reports of children. I myself was caring for one patient who was 27 years old, no other health problems, was bouncing from the floor to the ICU because there continued to be an increased oxygen need. So it's hitting otherwise healthy, young people as well, not just people over 50 or over 60 or over 70. Certainly not in the numbers that we see in the older patients, but it does affect everybody. And so it's everybody's responsibility to continue to do what we're asking, what the public health guidance is asking of you, staying physically, socially distanced, washing your hands, and also, not touching your face because, again, it does affect everybody. It does affect all ages. So,
Tammy, I wonder if our teams have you heard anything from our teams, this kind of story as well?
Thanks for that. Yeah, I do think that I so appreciate Dr. Hawkinson. We have to acknowledge that this is real. I think until you know someone who's been positively or tested and comes back positive, people don't necessarily always know it's real. It is absolutely real. And I think all we have to do is watch television and see what's happening in New York. And they're warning the rest of the country. They're saying, take notice because this is happening in our country. So I do think that we all have to be paying attention to this. And I think that clearly the healthcare providers in the community understand. There's just been amazing reach outs from one organization to another. We've become one really strong healthcare team in Kansas City. We've kind of taken off our local team jerseys and put on the Kansas City healthcare jersey, and I love that. I've known a number of different things that have happened. The nurses at Children's Mercy sent our nurses some treats, and our nurses sent them to St. Luke's, and St. Luke's to Advent, and those kind of things indicate to me that we are one big team, and we know that this is a big deal, and we have to pay attention. Kansas City can absolutely make a difference. I do know that you all have been saying this every morning for the last few weeks. Stay home. Make sure there is social distance. Make sure that you are washing your hands. Those are basic things. We absolutely can do this, but we have to work together, and everyone has to do it.
Here's my story. So my son's 24, and a little over a week ago, he had a cough and a sore throat. And he's not gotten sicker. I don't know if he has COVID-2 virus or not because we can't get testing. But we left him at home. And he's got his own apartment, so he was staying there. And, we try and drop some groceries off and maintain our distance, and then he picks them up and takes them on inside. But, it's hard because that's my son, and I can't see him. And my mother-in-law is 87. So imagine if we get sick, or he's sick, then I get sick, then she gets sick, and that's a whole lot of sick. And how do you stop it? I mean, last night he said, Dad, I'm kind of running low on laundry. And I said, well, there's always your bathtub. and he's 24 and he's healthy and he's doing a lot better. But for that 24-year-old son of mine, there's a 25-year-old daughter of somebody's here in our hospital on a ventilator. I don't know how to make this more real for people. if getting up in the morning and looking at the map and seeing how many red dots there are and seeing the spread and just knowing that somebody out there is sick and watching people die, if that doesn't make it real, then you got your eyes closed. And you got to open your eyes. Because if you open your eyes, you see what's going on. You see the threats to our businesses, our economy, our jobs, our health, our families, the people we love and care about. And the answer is always the same answer. You have to do your best. And what's your best? And our best is we can beat Corona. But it takes all of us doing the right thing. And we know how to do that because this is Kansas City, and that's the kind of stuff we do. So BKC, go out and stay at home. That's a funny way of saying it, but it's true. Go out and stay at home. Don't let your family, don't let your children get sick. That's a big toll. Next question.
If someone does require ventilator care, what's the average amount of time that they would be on that machine?
Yeah, that runs anywhere from about 12 to 21 days. It's not a short ventilation. It takes a while to get better from this once you go on a ventilator, and there's no guarantee you're going to get better. There's some data out there that says that only 15 or 20% of patients get better and get off a ventilator. Others say 50 or 60%. Our experience has been right about there so far in our patients.
Is anyone in a negative pressure room? I didn't know if you guys had that at KU.
Yes, we have a lot of negative pressure rooms. And
I'm sorry, go ahead.
no, we've actually converted entire floors to negative pressure over the last week in order to try and help with that. To be honest with you, if you look at the CDC recommendations, negative pressure isn't as highly thought about as it first was. It's not like Ebola. As we've learned about the virus, again, this virus doesn't have wings and it doesn't have legs. And so if you do the basics, you really can do pretty well.
Yeah.
Dan, anything you want to throw
Nothing
on
to
that?
add. That exactly. Yep.
Okay.
Whole floors to negative pressure.
So would that be all of the patients who are testing positive for COVID, they are all in a negative pressure room?
Today they are, but that totally depends on that are not again and how many patients we have.
I have a question about hay fever, and as sufferers of hay fever and allergies start sneezing and coughing, is that going to complicate keeping the virus from spreading?
Well, I don't know if it complicates keeping the virus from spreading, but it scares everybody. I was down here in the media room last week with Jill, and I was coughing and sneezing. She was like, "Are you okay? Are we both gonna have COVID after this?" And I said, "No, these are allergies, no fever, and all that. A little Benadryl makes it go away." And that's probably the key. A little Benadryl made it go away. And so the key is if you can treat your allergy and you don't have a fever and you don't have what is really a COVID-19 symptom with severe cough and diarrhea and things like that, I never lost my sense of smell or taste, then you're probably okay. But I think seasonal allergies are tough, Dana.
Yeah, that's one of the things. Hopefully we're moving out of the other cough and cold viruses and out of the influenza season now, although there is still pretty high activity. But instead of that, we're kind of moving into allergies, and we knew about that. But I would just echo with what Dr. Stites said. A little bit of Benadryl will help.
We have time for one or two more questions.
So with the hospital stopping elective surgeries, is that creating, a lot of, financial pressure on the hospital?
I'm glad Tammy's here for that one.
Well, certainly that's happening at hospitals across the country, and we know it's the right thing to do. We're glad we did it when we did, because we stopped our electric surgeries almost 2 weeks ago, and that was not because it's not safe. Of course, it's safe to be here. It's that we needed to preserve our PPE for our staff and for our patients. So we made the right decision. Is there a financial impact? Absolutely, there is.
Do you guys have the numbers?
Yeah.
No, I just.
Oh, let's just see. Nope, no numbers yet. Okay, so here's the deal. Last night we had 23 patients. I believe we had 12, or no, we had 14 ICU patients, and I think we had 10 patients on ventilators. So that was an increase from, I believe it was 18 to 22, because it kind of goes up each day. We have a morning run and a night run with our instrument. So that's the numbers we had. And once we get these other numbers, well, of course, we'll be talking about it tomorrow again.
Yeah. And could I add something too, as you had just stated with the numbers? You know, we've said before, and this has been consistent, a majority of infections and people who are infected are going to be able to stay home. If a small percentage of those people will need to come to the hospital for care, supportive care, but even a smaller percent will be in the ICU in critical care. And as we can see from Dr. Stites and from the numbers, the majority of our patients here are receiving critical care services because, you know, that's kind of what we're seeing, and that's how our patients are that are having to come to the hospital.
You know, we said originally it was about 20% of people had to be hospitalized, but it looks more like it's in the 10 to 15% range, and maybe even a little lower, which is, that part is good news. The bad news is that those who have to be hospitalized tend to need ICU beds. So we're probably about.
Go over the symptoms of when you need to come into the hospital.
Oh, yeah.
That's a good idea.
It's all about shortness of breath. If you get lightheaded or dizzy or mental status problems, then you can obviously come into the hospital. But really, it's shortness of breath that drives the need to come into the hospital. That's the key symptom. So, well, as we wrap up today, I didn't know if Tammy or Dana had any final thoughts or words of wisdom.
No, I think I just wanted to make sure that you all and our community is aware of how much we appreciate all the support from the videos that have been sent to our teams. Eric Stone Street sent one last week. We had a number of people in the community send the videos of just encouragement to our staff, and that's been really important. John Holt sent one last week as well, and we're going to be sharing those all week with our teams and with our staff, because this is hard work, and we appreciate all that you're doing and certainly all that the community's doing.
Dana, any last words?
Nope, that's it. You know,
Well,
again.
You know what I'm going to say? It's the same thing I always say. There's
Stay
no
home.
place like there's no place like home. There is no place like home. Thank you all.